Over the past 2 decades, death rates for major cancers such as lung, colorectal, breast, and prostate have declined, yet mortality from pancreatic cancer has continued to climb. According to the latest global cancer statistics from 2022, pancreatic cancer is the 12th most commonly diagnosed cancer worldwide, with over 510,000 new cases reported that year. Despite its relatively lower incidence, pancreatic cancer ranks as the sixth leading cause of cancer-related deaths for both men and women, accounting for nearly 467,000 deaths globally in 2022. That's because even with radical surgeries aimed at completely removing the tumor, many patients face recurrence. As a result, the chance of living 5 years after being diagnosed is still very low, usually less than 10%. On the other hand, unlike colorectal cancer, which can be screened with colonoscopy or fecal immunochemical tests, breast cancer with mammography, and prostate cancer with the PSA blood test, pancreatic cancer currently has no standard screening tool for early diagnosis in healthy people. A definitive diagnosis usually involves a combination of imaging scans and blood tests. But these are generally only performed once symptoms appear. That's why recognizing the warning signs is so important. In today's video, we'll discuss 14 symptoms of pancreatic cancer that you absolutely must not ignore. Let's start with jaundice. The symptom jaundice arises from buildup of bilirubin in the blood, a yellow-brown substance made by the liver as part of bile. Typically, bilirubin is produced from the breakdown of red blood cells, then processed in the liver where it becomes conjugated. This conjugated bilirubin travels via common bile duct to small intestine to be eliminated from the body. Anatomically, the pancreas is divided into the head, body, and tail. The pancreatic duct runs through the pancreas and joins the common bile duct, which carries bile from the liver and gallbladder. These two ducts merge within the pancreatic head to form the ampulla of Vater, a dilated structure that opens into the middle part of the duodenum. The flow of bile and pancreatic juice into the duodenum is controlled by the sphincter of Oddi surrounding the ampulla. This coordinated system ensures efficient delivery of digestive enzymes and bile for digestion. Notably, 60 to 70% of pancreatic cancers develop in the head, while 20 to 25% occur in the body or tail. The remaining cases involve the entire organ. Because symptoms often correlate with tumor location, understanding this anatomy is crucial. When pancreatic cancer forms near the head of the pancreas, it may obstruct or squeeze the bile duct. This blockage prevents bile from draining normally, leading to its accumulation in the bloodstream. The resulting excess bilirubin causes the characteristic yellow discoloration of the skin and eyes, known as jaundice. Note that jaundice from pancreatic cancer is usually progressive, beginning with yellowing of the eyes and spreading downward across the face, trunk, and legs. Obstruction of biliary system by pancreatic head tumors can cause pale stools and unusually dark urine as well. Bilirubin, produced from red blood cell breakdown, is conjugated in the liver and excreted into the intestines via bile. In the gut, bacteria convert conjugated bilirubin into urobilinogen, which is partially reduced to stercobilinogen. Stercobilinogen is then oxidized to stercobilin, which gives stool its typical brown color. Meanwhile, some urobilinogen is reabsorbed into the bloodstream, filtered by the kidneys, and excreted as urobilin, giving urine its characteristic yellow hue. However, when a pancreatic tumor obstructs the bile duct, bilirubin cannot enter the intestines. As a result, the usual breakdown products, urobilinogen and stercobilinogen, aren't formed. This absence causes stools to lose their brown color and appear pale. At the same time, the buildup of conjugated bilirubin in the bloodstream leads the kidneys to excrete more of it, turning the urine a darker color than normal. These changes are clear signs of disrupted bilirubin processing due to the bile duct blockage. Another common symptom is severe itching. In addition to bilirubin, other components of bile, like bile salts, build up under the skin, causing itching along with jaundice, pale stools, and dark urine. People usually notice the itching is milder in the morning and gets worse at night, and it can come and go throughout the illness. Abdominal discomfort is a frequent complaint reported by patients with pancreatic cancer, even when tumors are small, measuring less than 2 centimeters. A recent review in Journal of Digestive Diseases and Sciences reported that in cases of cancer located in the pancreatic head, pain ranks as the third most frequent symptom, affecting about 72% of patients following weight loss and jaundice. For tumors in the body or tail, pain is the second most prevalent symptom, experienced by 87% of patients. At the time of diagnosis, 30 to 40% of individuals report abdominal pain, and as the disease advances, up to 80% develop pain, with nearly half describing it as severe. Typically, pancreatic cancer pain develops gradually over 1 to 2 months before diagnosis. It is typically described as a persistent, gnawing sensation located in the upper abdomen, which may spread to the sides or radiate straight to the back. This discomfort can be intermittent, often intensifying after eating or when lying flat, and tends to worsen during the night. Many patients find relief by curling up into a fetal position. Intense back pain should prompt consideration of a tumor located in the pancreatic body or tail. Occasionally, pain can arise suddenly, caused by acute pancreatitis, triggered when the tumor blocks the main pancreatic duct. Next on the list is cachexia. It's one of the most significant and recognizable challenges faced by cancer patients, often accompanied by anorexia. Pancreatic cancer, in particular, has the highest rate of cachexia among all tumors, affecting up to 80% of patients at the time of diagnosis. Anorexia refers to loss of appetite due to disruption of normal hunger signals, while cachexia is a debilitating condition due to involuntary weight loss and loss of skeletal muscle mass known as sarcopenia. Together, these symptoms are known as the cancer anorexia-cachexia syndrome. This syndrome typically involves a combination of poor appetite, severe tissue loss, malnutrition, weight loss, changes in taste and smell, and an inability to increase food intake enough to meet the body's energy demands. Coming in at number 7 on the list is steatorrhea, which refers to having an abnormally high amount of fat in the stool. It usually shows up as bulky, pale, and oily stools with a strong, unpleasant odor. These fatty stools often float in the toilet and can be difficult to flush. It's often caused by tumors in the head of the pancreas, since these tumors can block the main pancreatic duct that delivers pancreatic enzymes. When this happens, the pancreas produces fewer digestive enzymes during meals, causing steatorrhea as well as other vague signs of maldigestion, such as abdominal discomfort, bloating, and unintentional weight loss. When steatorrhea becomes severe, symptoms related to deficiencies in fat-soluble vitamins begin to manifest. These symptoms include impaired night vision and xerophthalmia due to vitamin A deficiency, bleeding tendency due to vitamin K deficiency, peripheral neuropathy and ataxia due to vitamin E deficiency, and osteoporosis due to vitamin D deficiency. However, these symptoms do not commonly present at the very beginning of pancreatic cancer. Pancreatic cancer has a strong and unique link with late-onset diabetes. In a recent study involving 100 patients diagnosed with lung, breast, colon, prostate, or pancreatic cancer, 68% of those with pancreatic cancer also had diabetes. In contrast, diabetes was present in only 15 to 21% of patients with the other cancers. Numerous epidemiological studies have consistently shown that people with diabetes have a higher risk of developing pancreatic cancer. Notably, among patients with pancreatic cancer who also have diabetes, 74 to 88% were diagnosed with diabetes less than 2 years before their cancer diagnosis. This highlights a dual causality relationship. Long-standing type 2 diabetes increases the risk of developing pancreatic cancer, while pancreatic cancer itself can also cause diabetes in many cases. Thrombotic complications, including pulmonary embolism and deep vein thrombosis, are common in pancreatic cancer, especially in patients with tumors located in the body or tail of the pancreas. A systematic review of the literature found that the incidence of venous thromboembolism in pancreatic cancer patients ranges from 5% to 36%, which is up to 50 times higher than in the general population. This increased risk is caused by the cancer inducing a hypercoagulable state through platelet activation and the release of procoagulant substances such as tissue factor and thrombin. Skin symptoms are uncommon, but important signs of pancreatic cancer. Pancreatic panniculitis is a rare complication seen in 2 to 3% of pancreatic cancers. It is characterized by painful, reddish or brownish nodules that develop due to the damage of fat tissue caused by pancreatic enzymes leaking into the skin. These nodules often ulcerate and release oily material, mostly appearing on the legs but sometimes elsewhere. Also, if you want to know about 6 early signs of colon cancer as the third leading cause of cancer globally, watch the next video now.